A patient in labor room reaches 8 cm dilation. The nurse notes a pattern on the fetal monitor that shows a drop in the fetal heart rate of 30 beats per minute, beginning at the peak of the contraction and ending at the end of the contraction. The fetal heart rate baseline is 165 to 175 beats per minute with variability of 0 to 2 bpm. What is the most likely explanation of this pattern? The options are A. The baby is asleep. B. The umbilical cord is compressed. C. There is a vagal response. D. There is uteroplacental insufficiency. The answer is option D. There is uteroplacental insufficiency. This question indicates a late deceleration. This type of deceleration is caused by uteroplacental insufficiency or lack of oxygen. The nurse asks the client with an epidural anesthesia to void every hour during labor. The rationale for this intervention is: option A. The bladder fills more rapidly because of the medication used for the epidural. Option B. Her level of consciousness is altered. Option C. The sensation of the bladder filling is diminished or lost. Option D. She is embarrassed to ask for the bedpan that frequently. The correct answer is option C. The sensation of the bladder filling is diminished or lost. Epidural anesthesia decreases the urge to void and sensation of a full bladder. A full bladder decreases the progression of labor. Question number 3. In evaluating the effectiveness of IV pitocin for a client with secondary dystocia, the nurse should expect. The options are: option A. Rapid delivery. Option B. Cervical effacement. Option C. Infrequent contractions. Option D. Progressive cervical dilation. The correct answer is option D. Progressive cervical dilation. Dystocia refers to prolonged or slowly progressing labor. The expected effect of pitocin is progressive cervical dilation. The nurse is caring for a 9-year-old child admitted with asthma. Upon the morning rounds, the nurse finds an O2 saturation of 78%. Which of the following actions should the nurse take first? The options are: option A. Notify the physician. B. Do nothing. This is a normal O2 sat for a 9-year-old. C. Apply oxygen. D. Assess the child's pulse. The correct answer is option C. Apply oxygen. Remember the ABCs: airway, breathing, circulation, when answering this question. Before notifying the physician or assessing the child's pulse, oxygen should be applied to increase the child's oxygen saturation. The normal oxygen saturation for a child is 90% to 100%. A 5-year-old client with hyperthyroidism is admitted to the pediatric unit. What would the nurse expect the admitting assessment to reveal? The options are: A. Bradycardia. B. Decreased appetite. C. Exophthalmos. D. Weight gain. The correct answer is option C. Exophthalmos. Exophthalmos is protrusion of eyeballs. It is often occurs with hyperthyroidism. The client with hyperthyroidism will often exhibit tachycardia, increased appetite, and weight loss. A. Gravida 2 para 0 is admitted to the labor and delivery unit. The doctor performs an amniotomy. Which observation would the nurse expect to make immediately after the amniotomy? The options are: A. Fetal heart tones 160 beats per minute. B. A moderate amount of clear fluid. C. A small amount of greenish fluid. D. A small segment of the umbilical cord. Answer is option B. A moderate amount of clear fluid. Normal amniotic fluid is stroke-allowed and odorless, so this is the observation the nurse should expect. An amniotomy is artificial rupture of membranes causing a stroke-allowed fluid to appear in the vaginal area. Greenish fluid is indicative of meconium, not amniotic fluid. If the nurse notes the umbilical cord, the client is experiencing a prolapsed cord. This would need to be reported immediately.